Hi, grade 9. It's been a while since we've had a Zoom lesson or a lesson at school. Um, so in lesson 9, I gave you an exercise where you had to do jumping jacks and measure your heart rate before and after, and then try and find out some examples of when a heart rate could be increased or decreased. I'm going to go over the model answer with now. And like I said, this would pop up later in the year when we do an exam or a cycle test, where I find out some information on fast or slow heart rates, and it could be a case study. So it's just an exercise to see what happens and to start thinking about it. Okay, so let's have a look at the document. All right, so here's my model answer. Now, the stethoscope, I've actually got a few in class that we normally use to measure our heart rates. All right, so hopefully you tried, you did take your pulse, and you did do the little exercise properly. So question number 1, now I just wrote down some answers here. So resting pulse rate could be 73 beats per minute. Well, it could actually be between 60 and 100 beats per minute, depends on the person. It's measured in beats per minute or BPM. Question number 3. So I asked you to do 30 jumping jacks. So I hope you did them. Then you have to take your pulse again. So maybe it was 104 beats per minute or higher or lower. What does this mean? What do you observe? Sorry. My heart rate increased by about 30 beats per minute. Okay, something about what did you observe? Okay. Then you have to sit quietly in a chair for a minute, take your pulse again and write it here. So maybe it went down to 76 beats per minute, or maybe it didn't go down as much. Okay, depends on the person. What did you observe? Write in your own words. My heart rate almost returned to normal after sitting in a chair for a minute. What did you observe? What happened to the heart rate? Then state the aim of the investigation using the correct format. So you always start with to determine, to investigate. Here we're looking at the effects of doing exercise on heart rate, or my heart rate. All right, research questions. Research what the typical healthy resting heart rate is in babies. Now, first aiders, if you've done the first aid course, the manual that I use for this information is the First Aid Level 1 course manual from Top Compliance, who the lady who often comes and gives first aid courses. So in babies, that's 0 to 1 years old, their resting heart rate is 100 to 120 beats per minute. Children from 1 to 12 years is 80 to 100 beats per minute. And adults could be normal resting 60 to 100 beats per minute. An adult is considered anyone who's 12 years or older. All right, then I ask you to go and research other factors. So not exercise, okay? State other factors which would result in an increased heart rate. So it could be due to various emotions, like being frightened, stressed, anxious, nervous, excited. Your health, if a person has an overactive thyroid gland, if you're anemic, if you don't have enough hemoglobin in your red blood cells, that can cause a higher than normal heart rate as well. Using stimulants, drinking coffee. I had a cup of coffee just now, and I was just, taking my radial pulse. And when I did it in the video of lesson 4, I think it was, I was just watching it just to see what I said, and I was counting my pulse there, and I just had a cup of coffee now, and I could feel that my heart rate was higher. So maybe we should cut down on the coffee, hey? All right, because it's a stimulant. Um, Alcohol is a stimulant. Taking drugs, I think things like ecstasy and that increase the heart rate. Some people can take ecstasy once off and have a heart attack. It just depends on the person, their body. Maybe they don't react well to certain medications, drugs, alcohol, etc. Smoking is a stimulant. Okay. Having high blood pressure, hypertension means that your heart has to push blood through very narrow blood vessels, like trying to squeeze liquids through a tiny little opening. That's really difficult for the heart to do. So that's high blood pressure. The heart rate will be faster, trying to work fast. And atherosclerosis. So we'll discuss this later on. But that is blockage of the little heart vessels in the wall of the heart. All right. Being unfit, or not being not as fit as somebody else. All right. Doesn't mean you're unhealthy if you're not as fit as someone else. Taking certain over-the-counter medications, having an infection or a fever, So then I looked up on the internet, and I looked at the Mayo Clinic website. They generally have nice, simple summaries. So the actual proper name for an increased heart rate is tachycardia. But it doesn't mean if your heart rate is 80 because you've been exercising or whatever, or sorry, at least 100. It doesn't mean that it's bad. So if I run, especially at the gym, when I used to run there, and then then the machine asks you to measure your heart rate, and for particular ages, they don't want your heart rate to go above a certain limit. So it always says that mine, and if it goes, I try and keep it below 150 for my age. So there are different heart rates that are better for people at certain ages. It just gives you an idea of how to train and pace yourself. Okay. So tachycardia is the medical term for heart rate over 100 beats per minute. But here we're talking about a resting heart rate, which is high. We're not talking about heart rate going up and then going down when you exercise and then when you rest. We're talking about it being persistently over 100 beats per minute. And that could be indication of some kind of underlying problem. Now, over here, taking certain over-the-counter medications, if sometimes I've got this postnasal drip and then that mucus, and I haven't for a while now, but sometimes I go to the chemist and I get I'm coughing a lot. I haven't been coughing too much this year. Something I get every year. And I get a cough mixture. I have to check if it's got something called bromhexine. I thought it was called bromhexamidine, but it's bromhexine. If the cough mixture has that, I can actually feel my heart. It goes like palpitations, and I can feel it throbbing in my temples. So that's tachycardia due to medication. So I always have to check if the medicine has this substance in it, because it doesn't agree with me. All right, then I asked you to go and look up 5 factors which result in a decreased heart rate. So being very fit, because now your heart is efficient and it doesn't have to beat so fast to push enough blood around the body. It's really fit. So you are fit, your skeletal muscles are very fit, and your heart is fit because you exercise your heart as well. And it becomes more efficient with every heartbeat. Being very cold, someone who's fallen into a frozen lake or into a swimming pool in the middle of winter, and that would slow down the heart rate because metabolism is slowing down. Having an underactive thyroid gland. So the thyroid gland is below the trachea, and it's a gland that controls metabolism. So there are conditions where if your heart rate is too fast, all right, there's actually a condition where the thyroid gland is not controlling metabolism properly, and therefore your heart rate is way too fast. And also if it's too slow, having an underactive thyroid. All right, but that's more in people as they get older. Okay, and then resting, doing yoga, meditation. Maybe we should do some of these. When you're sleeping, okay, when you're relaxing. And as we age, our heart slows down as well. So the proper word for a slow heart rate is bradycardia, slower than normal. But here we're talking about consistently slow, not slow, fast, which happens, in a normal day. So if it's consistently slow, lower than 60 beats per minute all the time, and the person isn't very fit, it could be indication of an underlying problem like underactive thyroid, etc. And this is bradycardia. All right, and I also got that from the Mayo Clinic. Okay, so that was just there. We've just gone over the little exercise, and now we're going to have a look at blood vessels. And I hope you've watched the videos in the last lesson.